in the story of progress, every chapter of development adds depth, richness, and meaning to our collective narrative. From the smallest steps to the grandest strides, every act of development paves way for a brighter tomorrow. Welcome to the Development Report on People's 105.5 FM, where we talk about pressing issues towards sustainable development. And interestingly, today we're going to have a conversation around something very important that happened yesterday. So yesterday was the World Malaria Day. Somehow, when I mention malaria, what comes to my head is mosquito. One way or the other, but thank God I'm not an expert, and that's why I brought an expert here to have this conversation with me. I have an amazing guest in the studio, and we're going to be doing justice to the topic before us today. We're looking at Malaria Ends With Us, health equity, and the SDG 3 fight. So we have Mr. Raphael Onyilo in the studio here with us, who is the head of ACSM, National Malaria Elimination Program. Great to have you in the studio today, sir.
Good afternoon to you all.
Good afternoon, sir. How are you doing today?
I'm doing fine.
Yeah, and we also have an amazing guest too. I know she was not in my flyer, but since she's already here today, and I know that you're part of this movement, we'll hear your voice. So shout out to Abuja.
Good afternoon, everybody, and thank you for having me.
Great. All right, so we're going to be having this conversation with our guest today. There are so many misconceptions around the issue of malaria. In fact, I also have my personal question to ask, and at some point I'm going to be opening the phone lines for us to have this conversation around issues with mosquito, malaria, and misuse of, medication, and some of the people who actually go for herbal treatment, and all like that. We're going to be having this conversation. So sit back, relax, as we'll come back to have the discussion about the World Day for Malaria.
105 FM brings to you the Development Report dissects current development issues, sustainable development goals, climate change, women and health, water environment, human progress, and societal well-being with experts from different fields. Development Report showcases impactful projects and initiatives aimed at fostering positive change. Development Report comes to you on the People's 105.5 FM Abuja every Saturday from 12:15 p.m. to 1 p.m. You can also join the program via telephone 0911 222 1055 or send us a WhatsApp message on 0911 112 1055. Development Report towards collective action in support of sustainable development. People's 105.5 FM. It's all about you.
All right, you're listening to People's 105.5 FM, and we are commemorating the World Malaria Day, and we're tying it to the SDG 3, talking about good health and well-being. And we have an amazing guest in the studio. We have Mr. Raphael Onyilo in the studio here with us, who is a specialist in this field, and he's going to be doing justice. I want us to start from our country, Nigeria. So, how would you assess Nigeria's current malaria situation, especially given, our position as, the country with the highest global burden of this issue?
Thank you very much. The position of the country as regard to the contribution to the global malaria cases, we are still high. But from the report, the World Health Organization and World Malaria Day report of 2024, our contribution has been reduced by 0.01.
Our contribution
has been reduced. The contribution to the global malaria cases has been reduced by 0.01%. We are occupying 27%.
Wow.
Now we are occupying 26.99. Approximately it's still 27%.
Still, yeah.
I'm getting it. And also the death is still 31% globally. And this call for a nation. Though the country have done a lot of things with the partners, but still we still have this high burden and as well debt. And therefore it has called for a nation for every stakeholders to come together and to step up our interventions and to step up our effort so that the prevalence will be reduced drastically. We are aiming 10%. And with this 26.99 or approximately 27 is still high.
Still high.
So, and therefore we are calling and advocating to all the major stakeholders to come to step up our effort so that we can bring up innovative strategies and approaches that will help us to fight against the disease which is actually causing a lot of death, especially among our children as well as the pregnant women. Thank you.
When people look at malaria, they might look at it as, in quotes, common. But then you mentioned something about death. I wanted to explain the how heavy this is, because hearing that in this time and age people actually die of malaria, I think it's something that people need to pay attention to.
And this is where we come inside as ACSM, Advocacy, Communication and Social Mobilization.
Yes.
And that is one of the misconceptions. They are calling malaria common, but it's killing. And because they are calling it common, they are not taking some of the interventions seriously.
Yes.
Especially as regard to sleeping inside net to prevent the biting of the mosquito that transmit the causative agent of the malaria. So because of that misconception, that malaria is common, but it is killing. So we are telling the whole country, the populace, that malaria, even though we are calling it common, but it's killing, and therefore we have to take it very, very seriously on all the intervention that is coming to our community. To take it very seriously and do all our effort to ensure that we prevent the biting of the mosquito that transmit the plasmodium.
Great. When you mentioned misconception, one of the things that actually came to my mind too is this thing about people saying if you are AA, you're prone to malaria more often. You treat, you could once you're AA and then you start feeling, oh, my mouth is bitter. The next thing people say, oh, you have malaria. So I don't know, is that a misconception that people really need to be spoken to about? So you don't say because you're AA and every time you feel uneasy, it means you have malaria, and that could actually lead to abuse of or misuse of medications.
Thank you very much. Like what you have said is not a study that has been established. It is not a proven study.
That's right.
Therefore, we cannot go on that line. And the advice is that once you are having fever, what next is to go to seek for the care.
That's right.
To go for test, because all fevers are not malaria. Fever is a symptom of many diseases.
Nigerians need to hear this.
Therefore, it should not come to our head that once you have fever or whatever thing is malaria, let's go for the test. So that issue they said is not a proven study.
That's right.
And therefore, we cannot base on that. And the advice is that once you have fever, you have to go for test and be sure that fever is malaria, because it could be other disease, even measles, even smallpox. Any of that disease can have a symptom of fever. So it's not malaria until when you carry a test.
That's right.
Thank you very much.
I love that last statement. It is not malaria until you have confirmed through test. Great. So looking at the topic or the theme for the World Malaria Day this year talks about Malaria Ends With Us, Reinvest, Reimagine, and reignite. How would you describe this theme, and what does it mean for us as a people?
Yes, the theme of this World Malaria Day commemoration, or we call it celebration.
That's right.
And when we ask, what are we celebrating? We are celebrating a lot of things because effort have gone inside. And just like I said, the prevalence is reducing. The death among our children, among the pregnant women is reducing because effort have gone inside to educate our people. Are you getting it?
Yes.
So the thing of this is a very critical. Malaria ends with us. Reinvest, reimagine, and reignite. These are three pillars in the thing. And the objective critically describe the need for you, for the major stakeholder, to re-energize our effort right from the beginning, from the global policy in all levels to the community action. We have to redouble our effort to ensure that we fight the disease to be conclusive by coming to the point that nobody can be infected and die of it. And also we are to advocate for more investment. More investment. Therefore, we are telling the major stakeholders, the philanthropists, to come inside, to contribute, to invest in the prevention, in the diagnosis, in the treatment. Diagnosis by buying the keys for diagnosis. Treatment by buying ACT, which is the recommended medicine by WHO for the treatment of malaria. And also, we are to promote, the objective was to critically describe the need for us to promote innovative strategies and approaches that will help us to fight the disease. As well, there is a need for us also to prioritize the country ownership. What do you mean by that? This can be achieved by engaging the community. Therefore, if there's any intervention going on in any community, the community members must be involved. Must be engaged from the planning to the execution of that intervention, to the implementation of that intervention. And this will help for sustainability. If you do not involve the community, if you don't engage them, how would that intervention be sustained in that community? That is why there is a need from this team, there is a need for us to prioritize the country ownership by engaging the community in the implementation and using a data-driven strategies. That means any intervention that should come out and be implemented where there must be a baseline survey that will give you a kind of a data and information. What are the needs? What are the shortcomings of this community? What they need for them to be able to fight against the disease? That's why there's a need for us to include that the community member. So in general, the thing is telling us that we need to redouble our effort for the fight against malaria. Everybody has to come inside. All of us, we are major stakeholders. That is why the thing say, malaria ends with us. We must all play our part. Re-energize our energy, our time, our commitment, and also to ignite our action and our passion for fighting against the disease. So that is what the thing is telling us. And I believe that from this thing, everybody will awake and stay awake.
Yes.
We have to awake and stay awake.
That's
so that
right.
we'll fight the disease to the conclusive.
Great.
Thank you very much.
I want us to thank God we have a female guest also in the studio. I want us to look at women and children who are also vulnerable to, the malaria issue. What word would you give to women, especially women who have, young children under 10, and, probably they have fever or something like that? How would you, address these women to attend to issues of malaria concerning their children?
All right. Thank you very much for that question. It's a beautiful one. Then before I answer that one, there's something that you said when we started. You referred malaria to as common, which I actually know that's what is going on out there. Everybody is seeing malaria as common. Malaria is not common.
Great.
There is this World Malaria report that we had. It says that 1 out of 4 persons having malaria in the world. And in the world, we have over 193 countries. Then one out of that 4 that have malaria is from Nigeria. That is to show how serious the thing is. In 193 countries, over 193 countries, and one out of the 4 is from Nigeria.
Wow.
Then the second one is that 1 out of 3 deaths as a result of malaria.
Wow.
1 out of that 3. Globally, still that over 193 countries is from Nigeria. Very, very endemic in Nigeria.
Honestly.
Then thirdly, 1 out of 2 persons having malaria in West African sub-region is Nigeria. And we have 16 countries in West Africa. So 1. The thing is so serious, so endemic in Nigeria. So we shouldn't see it as common. Then about 11 persons die every 1 hour due to malaria in Nigeria. Nigeria, this is our Nigeria. 11 died every hour as a result of malaria. It's not common. We should stop seeing malaria as common. It's deadly. It is a transmittable disease. Now, we had an outreach, I think day before yesterday. Yesterday we had an outreach. So the first 25 people that we tested, none of them had malaria. So I think the 26th person, the boy had malaria. We now asked the boy to go and bring their family members. They were, I think, 7. 5 of them tested positive. Malaria is transmittable. Through the bite of infected female Anopheles mosquito. So if it enters a household and infected one person, if you don't kill that mosquito, that's how it will continue.
Wow.
It will continue. Everybody will go down with malaria. And if it is not treated, it will lead to death. It leads to complication. From that complication, it is death. So we should stop this mindset of seeing malaria as common. Malaria is not common. Nearly 61 million malaria cases occur in Nigeria globally. 61 million cases of malaria. There is no disease that can have up to that in a year. But see what malaria can come up with. So it is not common. We should stop this idea of seeing malaria as common because it is not common. It is not our friend. It killed. Then coming to children. We talked about children under 5 and the pregnant women. We have interventions that we are deploying. We have what we call seasonal malaria chemo prevention. That one, we are targeting children from 3 months to 59 months. It is given to them at 28 days interval during the rainy season to prevent them from having malaria. So this medicine we call SP, SPAC, sulfadoxine plus amodiaquine. So it's a 3 days treatment, and it's just for prevention, not for treatment. So people should not mistook it as it's not for treatment, it's for prevention. So, and it can only be given to healthy children. We do have a CDDs, people that we call community drug distributors, a CDD. So they are going house to house administering this drug, because the first dose is supposed to be direct observed kind of a treatment that you'll be given in front of the caregiver to show how the caregiver will continue in day 2 and day 3. So that's what we do for children under 5. Then coming to pregnant women, we also have an intervention for them, which we call intermittent preventive treatment in pregnancy. That is why I want everybody out there, that your auntie, that your sister, that your friend, your neighbor, whoever female, any pregnant woman that you are close to, that please encourage them to register early for antenatal, because you cannot get this medication outside health facility. So you must register immediately you know that you are pregnant. And this SP is always given at monthly interval till delivery. So this SP will help the pregnant woman will prevent the pregnant woman from having malaria, and also protect the unborn baby.
Wow, so that's 2 in 1.
Yes.
Great.
And you will not just stop at taking the SP. You should ensure that you sleep inside net, because we in Nigeria, mosquito net is a primary vector intervention that we have. That one, it cut across. Both daddy, mommy, and children should sleep inside, not just like this SMC and IPTP that I am talking about. So we have a primary vector intervention, which is the ITM. So everybody should sleep inside the ITM. We not just one. I talked about a vector. That one is a primary. We have other vector management. I don't know whether my head of branch will talk about that one.
Thank
you.
I think let me just start for enlightenment, especially we are talking about prevention.
Okay.
In addition to what you have said, well, we have a lot of preventive measures. And one of it, which we know, is sleeping inside net. As an insecticide-treated net.
Insecticide-treated net.
So we are saying that when we give the net, we have to sleep inside. Observe all the procedure and sleep inside, not to use for that thing. And I know you may be aware, if not, you'll be informed, how do we get this net to the people in the rural area?
Exactly.
It's one of the concerns. And I want to let the populace know that we use what we call insecticide-treated net campaign for mass distribution to our populace in the rural area. In the state, everybody must have it. And we are glad to inform the populace that we have such campaign in 8 states this year. 7 states has gone controlled by Global Fund, and 1 state to those states by World Bank. We call it Impact Project. So it will go on this year, whereby the net will be distributed to every household, no matter wherever you are, no matter the remote area, that net will get to you. And this campaign will take place, as I said, in 7 states, and they said 8 states. 1 is Ondo State. Then among the 7 that is going to be controlled by the Global Fund, we have Kano, we have Kaduna, we have Niger, we have Taraba, we have Yobe, we have Delta. 7 states. So we are going to distribute net to everybody in that state.
When is this going to happen?
It's commencing from next month.
Amazing.
From next month.
Amazing.
And this campaign occur every year.
Oh wow.
Every year. After 3 years.
Okay.
So as we are having for the 8 state this year, then the next one will be the next 3 years for them.
Okay, so then you shift to another state.
Yes.
Oh, okay.
So every year. So this is to ensure that everybody in the country should have the net. And also, in addition, we have other preventive, we have indoor residual spray, which we also known before as shelters. You spraying shelters in the room to kill the mosquito. Then I want to let the populace know that in view of the fact that the minister, the Honorable Coordinating Minister of Health is interested, and the Director of Public Health, Dr. Godwin Entado, and the National Coordinator, Dr. Ina Obolafo, is interested in making sure the malaria breeding site is crashed. And therefore, there is an intervention that is coming up, which is being piloted in 6 states. And this intervention is called larval source management. And these are the states. We have Abia State, we have Borno State, we have Ekiti State, Lagos State, Ondo State, and Rivers State. We are piloting this intervention. And the essence is that the intervention is targeting management of mosquito breeding. We want to crash the mosquito breeding. We want to destroy the mosquito breeding. They decide they are breeding.
They're breeding.
And therefore, we are calling the populace that there is a need for us, critical need for us, to start keeping our environment clean.
Great. So
drainage. Make sure that we keep our drainage clean. Make sure that any pothole that we contain water, it should be filled up.
Wow.
And any receptacle container that will contain water to enhance the breeding of mosquito, it should be destroyed. And cleaning and so on. So this is the intervention that is coming up.
Amazing.
And we are believing that after we finish from the 6 states, for the next 2 years, we will scale it to other states to ensure that we destroy the breeding site of mosquito. We are bringing this intervention is very important because we have noticed that most of the countries that eliminate malaria, it is among the among the intervention I will use in complementing the use of ITN, use of indoor residual spray and SMC. This is also another intervention that was used in complementary. And this intervention is approved by WHO. So Nigeria is doing it 9 states.
Great. You just heard the voice of representatives, and they are actually from National Malaria Elimination Program. And I'll just pick one or two calls if you want to call in. So you tell us if you're calling in, do you know people actually die of malaria? That's the question I wanted. Do you know people die of malaria? And how do you attend to malaria? When you know that you have malaria, how do you attend to malaria? Let's know why you treat malaria the way you do. Would love to hear from you. Or probably if you prevent it, let's know how you actually prevent it. Would love to hear from you. So the number to call is 0911-222-1055. I call that again, 0911-222-1055. And you can also reach us on 0704-800-1055. Let's hear from you. Do you know that malaria actually can lead to death? And how do you actually treat malaria? Let's hear from you. And why do you choose the means at which you treat malaria? We have experts in the studio right now. These people are actually from the National Malaria Elimination Program, and they are we're commemorating the World Malaria Day that was held yesterday. We have them in the studio today, and they are doing justice to the topic we have before us. So we'd love to hear your contributions on the issue of malaria. We'll be right back.
Science, stories, and solutions of climate change. Join Climate Fact File and be part of the change every Wednesday from 11 a.m. on the People's 105.5 FM, Abuja.
It's time to care. Indeed, it's time to care about our planet and the earth we all share. Climate Fact File has the key to build a world that is completely green and free. Climate Fact File has taken a stand to learn the truth, protect the land, deal with the rising seas, ensuring cleaner skies, clean energy, and turning darkness into light. Climate Fact File is your one-stop shop for everything climate, including environment, waste and waste disposal, indiscriminate use of plastics, activities of oil and gas companies, gas emission, pollution, land management, rising sea levels, bush burning, flooding, desertification, and more. This is a call to action as every voice matters to save the earth. It's in your hands and it's in my hands. Climate Fact File is for a brighter, greener, and a better future. Let's keep it alive. Join me, Ife Onyekwere, every Wednesday from 11 a.m. on People's 105.5 FM. Climate Fact File remains our present reality. People's 105.5 FM is all about you.
All right, you're still listening to People's 105.5 FM, and we are discussing Malaria Ends With Us, Reinvest, Reimagine, and Reignite. Amazing. So I want us to talk about, meanwhile, we've had lots of conversation around this issue of malaria, some of the misconceptions, and some of the steps we need to take. Our guest has even given us breakdown of how serious this issue of malaria is, and boiling down to, we are one of the people, like Nigeria is one of the countries that actually have, a high burden of malaria. I think it's something we really need to pay attention to. Now, let's talk about households that still delay treatment or rely on informal sources. How can we reshape, this community behavior around early diagnosis and proper treatment? Because truthfully, we have people. We actually see some of these things from probably social media or communities where you go for campaign and all like that, and people really rely on informal sources. Okay, there's one Agbo there that sells this thing. She says, if I take this, I'll get well. And I'm like, so how do we, react to things like this? How can we make this reduce to the drastic, level as much as we can?
Thank you very much. And that is where the ACSM come inside. We have to ensure to advocate and to communicate, to bring messages through sensitization and through various channels. We are educating our people.
That's right.
Like what we are doing here is part of it. To educate our people through various channels, sensitization through media, radio and television, so that they have that change of behavior from negative to the positive. And also, even in the community, we have what we call community dialogue. And also, it's a forum also that we give a talk. We sensitize our people on the right information on malaria prevention, diagnosis, and treatment. And also, the pregnant women, even not only pregnant women, those that go to the hospital, that's what we call health talk. In the ANC, there's always health talk given to our pregnant women and whosoever that is around that place, to know the importance and what they are to do, the preventive measure for malaria and so on. So we are doing all this, and I want to tell you that since we came on board, there has been an increase in the knowledge on malaria prevention, diagnosis, and treatment.
Yes.
And therefore, we have a kind of change, a shift from negative to positive. But despite that, we are still stepping ahead. We will continue because our work is a continuity in giving messages,
that's right
information to our people. And we are using this means also to the media. Just like we are here now, let media collaborate with us, invite the people from the program, officers from the program, to give a talk like this, to educate our people, to create awareness, to give them right information on what they're supposed to know. And I believe that with this, there will be change, a shift from negative to positive. Just like I said, we have seen a lot of results. We have seen a lot of results, the outcome. And the outcome is that there's an increase in the knowledge of what our people need to know about malaria. Thank you very much.
Amazing. All right. So I want to hear from my fellow female in the studio. I want you to tell us what, from your idea in all this campaign and all this strategy that you're putting together. What does a malaria-free Nigeria look to you, and what must change for this vision to become a reality?
Thank you very much. Malaria-free Nigeria, it can only happen, it can only be achievable if only we are committed. Yes, it starts from the households. It starts from you, it starts from me, it starts from everyone and individually. If we have that mindset that it is possible. After all, other countries have eliminated malaria, so why wouldn't we? It's possible for us to eliminate if only we'll be committed in the fight against malaria. Amazing. By doing what? By getting rid of all the breeding site of mosquito. My head of branch said something about that. He mentioned it. But not just those stagnant water outside alone. That glass of water that you couldn't finish, maybe you drop it by your bedside and it stays there for like 3 days, automatically becomes a breeding site for mosquito inside your bedroom. Those your water storage in your kitchen, in your bathroom, without covering it, it is a breeding site for mosquitoes. So taking precautions of all those things, covering your water storage, getting rid of all those water bodies around you, around your house, clearing the bushes. By so doing, sleeping inside the net every night, screening your windows, your doors, depending on the area that you live.
Yes.
If you are outside, you wear protective clothing. We have repellent cream. Use all those things. Protect yourself. This mosquito is not all the mosquitoes that transmitted this parasite. It's only the infected ones. So you shouldn't be that scared.
Thank you very much for that correction. Okay, we'd love to hear from you.
Just to add to what you have said, if you remember if you'll be informed now that the slogan, we have the global theme for the World Malaria Day.
Yeah.
But each country has a slogan.
Yes.
And our slogan for this year is stay committed. Stay committed. Stay committed in the action. Stay committed in your commitment. Stay committed in your passion to fight against the disease. So there is a need for us to stay committed in collective collaboration, synergy, work together to ensure that the disease is fought to the conclusive matter. Just like you said, it needs all of us to come together to have a synergy in this fight.
Yes.
Thank you.
I want to round off now, and I just want you to tell us one step to take right now. People who are listening, what step do you need to do? Do they need to take to actually ensure that they are also part of this fight to ensure that we eliminate malaria?
Yes, one of the steps, just like I said, if any intervention is coming to your community, buy in immediately into that intervention and be part of the planning from the beginning, because it is then that there will be sustainability of that intervention in that community.
Great.
2, we are giving net. Net is one of the core preventive measures. And we are telling our people that sleep inside the net. Don't use the net for that thing. 3, fever is not malaria.
That's right.
All fever is not malaria. Therefore, when you have fever, you have to go for test. The test is very simple. We call it, the one of the tests, the primary test is malaria rapid diagnosis test, which can take about 15 to 20 minutes. Therefore, encourage everybody to go for test. And when you are tested positive, you will be given the right prescription of taking ACT. And once you commence, you must complete it. Thank you, and the Lord bless you.
Thank you so much for that. Unfortunately, we have to call it a wrap because of time. Yeah, because I wish we could go on and on. This is really very enlightening, but I think we need to have this conversation again beyond the World Malaria Day. It's something we really need to talk about. So many misconceptions out there and so many things to be corrected. We can continue this conversation on X, Twitter. I am at Ife Inspires. Let's continue the conversation right there. And I want to thank everyone who has listened to this show. Thank you so much. And I want to tell my producer, sleep on that net, Mr. Akpan. Sleep on that net. Treated mosquito net. All right. Thank you so much to my amazing guests for gracing the studio today. Thank you so much. And for everyone listening, this is also a movement towards sustainable development. And remember, we need to ensure that all hands are on deck to make progress towards the SDG. And particularly, this is pointing towards SDG 3, health and well-being. Thank you so much. And I'll be here same time next week on People's 105.5 FM. And I also want to thank the executive producer of this show, Charles Carlo. Thank you so much for listening. Until next time, bye. I am Ife Onyekwere.